Good morning, class. Today we will study Chapter 22, Together Health Education and Risk Prevention. I am your presenter, Tan Yukin. The focus of this chapter is to explore how to improve the quality of life for older adults through health education and risk prevention, centering on their lifestyle habits, ability, maintenance, and safety risks. Now let's look at the chapter outline. Today's lesson mainly consists of 3 parts. Part 1. Health education on lifestyle habits for older adults. Part 2. Ability maintenance and psychological adjustment for older adults. Part 3. Safety risk prevention for older adults. These 3 components form a comprehensive health education system for older adults. Let's begin with the first part, health education on lifestyle habits for older adults. First, regular and balanced diet. Older adults should develop the habit of eating at regular intervals and in appropriate portions, ensuring a balanced intake of various nutrients such as proteins, vitamins, and dietary fiber. Special attention should be paid to reasonable food combinations, avoiding overeating or excessive dieting. Second, regular routine and adequate sleep. Older adults should maintain a regular daily schedule with a recommended 7 to 8 hours of sufficient sleep per day. It is particularly important to emphasize that sleep aids should only be used under a doctor's guidance to avoid dependency from self-medication. Third, maintaining good hygiene habits. We will focus on 4 key aspects of oral hygiene. Use a soft bristled toothbrush with a small head to brush your teeth. To avoid bacterial growth, your toothbrush should be replaced at least every 3 months. Fluoride toothpaste is recommended. It can also be used alternately with chlorhexidine toothpaste, chlorophyll toothpaste, and traditional Chinese medicine toothpaste to prevent and reduce oral problems. Use the horizontal scrubbing brushing method to brush your teeth. Each brushing session should last at least 3 minutes, and you should brush your teeth at least twice a day, morning and evening. Rinse your mouth after eating. Now we proceed to the second part, ability maintenance and psychological adjustment for older adults. 1. Engaging in appropriate exercise. Exercise is an important way to maintain physical function in older adults. Suitable exercises for older adults include aerobic exercise, strength training, flexibility training, as well as balance and coordination training. Exercise should avoid intense and dangerous activities, opting instead for safe, sustainable, and practical forms of exercise. The timing and intensity of exercise are also very important. The best time for exercise is between 3 o'clock and 5 p.m. It is recommended to exercise once or twice a day for about 30 minutes each time. To determine whether the exercise intensity is appropriate, 2 criteria can be used. After exercising, rest for 5 minutes and see if the pulse returns to normal. Or during exercise, the pulse rate per minute should not exceed 180 minus one's age. For patients with hypertension or coronary heart disease, the heart rate during exercise should be controlled within 120 beats per minute. This approach allows for physical exercise while ensuring safety. In addition to physical exercise, psychological adjustment is equally important. Older adults are prone to feelings of uselessness and a lack of confidence in life. We should guide them to maintain a positive attitude, face aging squarely, and accept themselves. At the same time, they should learn to compromise appropriately, avoid being overly calculating, and maintain an open mind. Reasonable emotional release, such as talking with friends, singing, or painting, can effectively alleviate emotional stress. Paying attention to the emotional health of older adults is also an important component of health education. When older adults feel sad or depressed, they can alleviate these emotions by diverting their attention. For example, encourage them to engage in activities they are interested in, such as gardening, writing, playing chess, or participating in community activities. Hobbies can help them overcome negative emotions, strengthen social connections, and enhance life satisfaction. This is also a non-pharmacological intervention method for psychological adjustment, simple, easy to implement, and worth promoting. Now let's look at the third part, prevention of ability impairment risks in older adults. As age increases, the memory and motor abilities of older adults will decline to some extent. To prevent ability impairment, first and foremost, it requires the efforts of older adults themselves, such as maintaining exercise, learning new knowledge, and preserving good lifestyle habits. Diet, rest routines, smoking cessation, and alcohol moderation can all delay decline. Secondly, it's important to cultivate a healthy mindset and actively cope with difficulties in life. Through these measures, independent living ability can be maintained to the greatest extent possible. In addition to the efforts of older adults themselves, the support of family members and caregivers is also crucial. For example, it's important to listen patiently, maintain eye contact with older adults, help them express their true thoughts, and alleviate psychological stress. Concurrently, demonstrating genuine concern through concrete actions such as providing companionship, offering reassurance, and giving encouragement is crucial. Non-verbal care, such as a smile or a word of recognition, can make older adults feel understood and respected. Family and societal support are important safeguards for preventing ability impairment. Next comes safety risk prevention in older adults. Falls represent one of the most prevalent accidental injuries among older adults. For fall prevention, older adults should be advised to avoid abrupt movements when transitioning from sitting to standing or ambulation. Following postural changes, it is recommended to rest for 1 to 2 minutes before initiating movement. Residential flooring surfaces should be maintained in a dry condition to prevent slipperiness. Adequate illumination should be provided during nighttime hours to avoid ambulation in darkness. Through meticulous attention to these details, fall risks can be substantially mitigated, thereby ensuring the safety of older adults. Thermal injuries are frequently observed in the geriatric population. Adjusting water temperature to should not exceed 43 degrees Celsius. Allowing soups and beverages to cool to warm temperatures prior to consumption. exercising caution regarding steam exposure and hot surfaces during culinary activities, securing thermoses and water dispensers in fixed locations to minimize accidental contact, presetting appropriate temperature parameters when utilizing heating appliances. Through standardized daily practices, burn incidents can be effectively prevented. For wandering prevention, 4 measures can be taken. 1. Utilization of anti-wandering positioning devices. 2. Preparation of comprehensive emergency contact cards. 3. Implementation of memory enhancement through structured daily routines. 4. Provision of accompaniment for outdoor activities among high-risk individuals. For choking prevention, the following measures are very crucial. 1. Avoidance of highly viscous, desiccated, or pungent food items. 2. Maintenance of seated or semi-recumbent positioning during meals. 3. Observance of a 30-minute upright position postprandially. 4. Implementation of daily swallowing exercises to enhance safety. Additionally, regarding medication safety, older adults must strictly adhere to medical prescriptions, refraining from self-adjusting dosages based on personal experience or arbitrary decisions. Medication error prevention. Older adults must strictly follow doctor's instructions when taking medication, store medicines correctly, and undergo regular checkups. Family members should acquire knowledge about medication usage and enhance communication with physicians. Special attention must be paid to medication errors, including taking wrong drugs, incorrect dosage, and consumption of expired medications. Please complete the following after-class reflection questions based on the content learned in this chapter and common safety risks for older adults. Case: Mr. Zhang, 76 years old, has mild cognitive impairment and lives with his son. Recently, his family noticed that he often forgets whether he has taken his blood pressure medication, sometimes taking multiple doses in one day. Yesterday, he slept in the bathroom but fortunately was not injured. Mr. Zhang also prefers walking around the house in slippers, despite repeated persuasion from his family. Questions: 1. Identify at least 3 main safety risks Mr. Zhang is facing. 2. Provide specific prevention suggestions for family members regarding one of these risks. Today's lecture ends here. Through this chapter, we can see that health, education, and risk prevention for older adults involve multiple aspects including diet, daily routines, hygiene, exercise, emotional well-being, and various safety concerns. It requires not only the efforts of older adults themselves, but also the collective support of family members, caregivers, and society.